everyone watching our video. Today we'll be talking about emphysema. Our group consists of myself, Ryan, Shayler, Yesenia, and Olivia. Emphysema is an important topic for the community to be aware of so that they can minimize the risk factors and make appropriate lifestyle changes.
Emphysema is defined as a long-term lung disease. It is a chronic lung disease caused by the damage to the alveoli, the tiny air sacs in the lungs where the exchange of oxygen and carbon dioxide takes place. Emphysema occurs when the air sacs in your lungs are gradually destroyed, making an individual progressively more short of breath. Emphysema is one of several diseases known collectively as chronic obstructive pulmonary disease, also known as COPD. As it worsens, emphysema turns the brown air sacs, clustered like bunches of grapes, into large irregular pockets with gaping holes in their inner walls. This reduces the surface of areas of the lungs and in turn the amount of oxygen that reach into your bloodstreams. Emphysema also slowly destroys the elastic fibers that hold open the small airways leading to the air sacs. This allows these airways to collapse when you breathe out, so the airs in your lungs cannot escape. Treatment may slow the progression of emphysema, but it cannot reverse the damage. So these are some signs and symptoms that you may see with an individual with emphysema: shortness of breath, coughing, sputum production. This is what you may see in an individual that has been diagnosed with emphysema. Risk factors for emphysema. Smoking. Emphysema is more likely to develop in cigarette smokers, but cigars and pipe smokers are also susceptible. The risk for all types of smokers increase with the number of years and the amount of tobacco smoked. An individual's age. Although the lungs damage that occurs in emphysema develops gradually, most people with tobacco-related emphysema begin to experience symptoms of the disease between the ages of 40 and 60. Exposure to secondhand smoke. Secondhand smoke, also known as passive or environmental tobacco smoke, is smoke that you inadvertently inhale from someone else's cigar, cigarette, or pipe. Being around secondhand smoke increases your risk of emphysema. Occupational exposure to fumes or dust. If you breathe fumes from certain chemicals or dust from grains, cotton, wood, or mining products, you're more likely to develop emphysema. This risk is greater if you're a smoker. Exposure to indoor and outdoor pollution. Breathing indoor pollutants such as fumes from heating fumes, as well as outdoor pollutants such as car exhaust, increase your risk of emphysema. There are several ways emphysema can be detected. Chest X-ray. A chest X-ray can help confirm a diagnosis of advanced emphysema and rule out other causes of shortness of breath, but an X-ray alone isn't enough to make an accurate diagnosis. Computer tomography. CT scans combined with X-ray images taken from many different directions to create cross-sectional views of internal organs. Your doctor may want you to have a CT scan if you're considering having lung surgery. Lab tests. Blood taken from an artery in your wrist can be tested to determine how well your lungs transfer oxygen into and remove carbon dioxide from your bloodstream. Lung function tests. These non-invasive tests measure how much air your lungs can hold and how well the air flows in and out of your lungs. They can also measure how well your lungs deliver oxygen to your bloodstream. One of the most common tests used, a simple instrument called a spirometer, which you blow into to determine how much air can be taken in and out of your lungs.
Around 4.7 million Americans have been diagnosed with emphysema. According to the CDC, in 2011, around 10,000 deaths were related to emphysema. Annually, there is a 3.2 death rate per 100,000 population. Among the different ethnicities in America, white Americans have a higher incidence, while Hispanics have death rates that are lowest. Genetically, alpha antitrypsin deficiency has been linked to emphysema. Alpha antitrypsin deficiency is a genetic risk factor that can lead to emphysema. It is an autosomal recessive disorder that may affect the lungs or the liver. The low levels of ATT result in insufficient inactivation and subsequent destruction of lung tissue. Although the lung damage that occurs in emphysema develops gradually, most people with tobacco-related emphysema begin to experience symptoms of the disease between the ages of 40 and 60. Lung function normally declines with age. Therefore, it stands to reason that the older person, the more likely they will have enough lung tissue destruction to produce emphysema. Gender-wise, it is more common in men, but the number of women with emphysema is increasing. This is more than likely due to the fact that more women are smoking than they have before. Women, when they acquire emphysema, have a lower quality of life and more exacerbations compared to men. And then more women are dying to emphysema compared to men. Geographically, high levels of urban air pollution can increase the risk of emphysema. The overall percentage of emphysema sufferers is highest among the non-Hispanic, those 65 years or older, men who have to reside in the south of the United States.
Treatment and management of emphysema. Smoking cessation is the most effective treatment for managing emphysema. After stopping smoking, the disease progression stops and in some cases symptoms improve. Oxygen therapy can be used to reduce difficulty of breathing and to allow for more activity. Bronchodilators are used to ease the work of breathing, and anticholinergic agents manage dyspnea. Effects of emphysema on the dimensions of health. Physically, emphysema affects people in many ways. Improper oxygenation over a long period of time can lead to skin breakdown, heart failure, excess fluid volume, and muscular atrophy. It can also make it difficult for them to perform their daily tasks. Emotionally, it may affect them as their independence decreases and their dependence on others increases. They may not be able to participate in activities they used to enjoy like hobbies, and in some cases may no longer be able to live independently. Socially, they may be unable to participate in social events that they used to enjoy. They may be too weak or lack the physical stamina to participate in these social events or hobbies, or they may feel anxiety about carrying their oxygen or worrying that they don't have proper medications with them. With patients that have emphysema, it's important that they get the support that they need. Just let them know that it's important to express their feelings. Emphysema limits some activities and can affect the family's plans and routines in ways that you can't always anticipate. If patients and their families can openly talk about each other's needs, they'll be better able to meet the challenges of living with this disease. Be alert to challenges in their mood and their relations with others, and also they should not be afraid to seek counseling if they need it. Also, it's important to maybe consider a support group. Maybe people may have a stigma against support groups, or it may not be from everyone. But for those that do attend support groups, they can be a good source of information about new treatments as well as coping strategies. And it can be encouraging to spend time with other people in circumstances similar to what patients may be going through. If they're interested in a support group, just let them know to talk to their doctor or contact your local chapter of the American Lung Association. So about that, what the American Lung Association offers, they offer a club called the Better Breathers Club. And it's an opportunity to learn ways to better cope with COPD, like Shayla mentioned earlier, and while getting the support they need and others that share their struggles. These support groups give you the tools that you need to live the best quality of life that you can. There are various locations in the Houston area as well as nationally. These Better Breather Clubs meet nationally and feature educational presentation on a wide range of relevant topics such as how COPD affects the lungs, breathing techniques, exercise, talking with their physician, medication and other treatment options, medical tests, supplemental oxygen as far as the correct do's and don'ts about that, home health care, lung transplants, and as far as air pollution, which we live in Houston, that is a big issue here. So what are the goals about rehab and the services that you can offer? It's very important to remember that COPD at this time has no real cure. So the goal of therapy is really going to be centered on to provide relief for symptoms, prevent complications, as well as slow the progression of this disease. Quitting smoking is also essential for patients with emphysema, since continuing to use tobacco products will further damage the lungs. So smoking is so important, so it's important to give patients resources they need to learn about smoking cessation. So when we look at rehabilitation, we're going to focus on pulmonary rehabilitation. And this is a broad program that helps improve the well-being of people that have COPD problems or breathing issues. Rehab may include an exercise program, disease management training, as well as nutritional and psychological counseling. It's very important that we look at these patients from a holistic view and not just, this patient has COPD, so let's just treat that. This program's goal is to help the person stay active and carry out their daily activities. The rehab team may include doctors, nurses, physical therapists, respiratory therapists, exercise specialists, and then finally as well as dietitians. These health professionals will create a program that meets the person's needs, and it's very interdisciplinary. So finally, here are a list of references that we use for our presentation, and I hope that you enjoyed learning about emphysema today. Thank you.